Thank you very much, everybody. Thank you. So, America continues to wage all-out war to defeat the virus, this horrible.
Law enforcement and national security work must go forward, protecting the American people from the full array of threats. For the Department of Justice, one of our highest priorities must remain destroying the Mexican cartels. Their trafficking is largely responsible for the deaths, as we all know now, of 70,000 Americans a year. And also the costs of this don't count the destroyed families, the destroyed lives, the draining of our national treasure as state budgets are crushed by the burden that this narcotic trafficking causes. The President has made clear that we are in this fight against the cartels to win, and that we are not interested in half measures, and that the threat posed by the cartel is not just a law enforcement threat, but a national security threat as well. And in December, building on your success with the Mexican president in forging a cooperative relationship in the area of immigration, you asked me to go down and meet with the president, Lopez Obrador, and our Mexican counterparts to see if we could also establish a more comprehensive and coordinated effort with the Mexicans in confronting the cartels. And we've had some successful visits and discussions, and currently have an array of activities underway against the cartels. And we anticipate, along with the Mexicans, that these are going to bear fruit in the months ahead. But it quickly became clear that we can obtain the most immediate results, the best bang for the buck, where we increase the assets involved in interdiction on both the Pacific and Atlantic side of Mexico and the Central American countries. For years, the cartels have been using these sea routes to take the cocaine up from principally Colombia, now also out of Venezuela. And these sea routes on both coasts have become the primary means of bringing cocaine up to the United States. Because of the superb work done by the Defense Department and our intelligence community, we know exactly, most of the time, where these traffickers are at sea. But we're have been up till now, significantly limited in our ability to interdict because of the numbers of the assets we have deployed. Prior today, this limitation meant we could only intercept a fraction of the traffickers that and the various boats that were detected. This will now double our capacity, and we are talking about hundreds of tons of cocaine now we're now in a position to seize. So this is going to radically improve our interdiction efforts and put tremendous pressure, we think, on the cartels. And the effort that Southcom is undertaking is going to save lives by taking drugs off the street. Last week, I announced the unsealing of charges of narco-terrorism, drug trafficking, and other crimes against the former Maduro regime, 16 members of that regime, and their involvement in trafficking of 250 metric tons a year. A lot of that comes by sea, as I discussed at that time, but also because of the pressure we're applying by our sea interdiction, they are trying to establish an air route out of Venezuela up into Central America, which is one of the reasons we're trying to move firmly against that corrupt regime. This drug war has gone on for many decades, and at times in the past, we've had great success and great results, and at times we've taken our eye off the ball. Fortunately, not in this administration, and I'm grateful that you, Mr. President, have brought focus to this fight and the determination to use whatever tools are necessary to win the fight. The cartels have to be defeated, both for the people of this country and for the people of Mexico and Venezuela. So I'd like to thank you again, Mr. President, Secretary Esper, for providing the wherewithal required to help win this war against the cartels and others who seek to send illicit drugs into our country. And with that, I'd like to introduce Ambassador O'Brien.
Thank you, General. Thank you, Mr. President. Today's action is another example of the bold leadership of President Trump and his commitment to protecting the homeland against threats that seek to destabilize the United States and our Western Hemisphere. The uncontrolled flow of illegal drugs into the United States poisons our communities, fuels the dangerous epidemic of addiction, and threatens the safety and security of all Americans. The impressive U.S. Navy, Coast Guard, Army, Marine Corps, Air Force, and interagency operation will address a range of threats to our national security posed by narco-traffickers and narco-terrorists. It will reduce illicit financial support for drug trafficking that provides the corrupt Maduro regime in Venezuela and other bad actors with the funds necessary to conduct their malign activities. Under President Trump's leadership, we will continue to execute our maximum pressure policy to counter the Maduro regime's malign activities, including drug trafficking. And this operation will help to choke off the funds that go to that corrupt regime. Maduro, narco-terrorists, and criminals should make no mistake that even as we are working around the clock to fight the spread of coronavirus, we will continue to execute the President's counter-narcotic strategy. We are working on a number of important national security priorities as we face this public health crisis. The United States will continue to combat disinformation and fake news about this virus. We will work with the world's largest oil producers to address volatility in global oil markets. We will always protect our servicemen and servicewomen around the world, including in Iraq and Afghanistan. I want the American people to know that President Trump and Vice President Pence and their administration are working tirelessly every day to protect the health and well-being of Americans and respond to the coronavirus. Our adversaries should take note, however, this president has a clear-eyed focus on America's national security interest. And let me be clear, it would be a mistake with terrible consequences for any adversary to attempt to do us harm during this health crisis or ever for that matter. Thank you very much. Thank you, Mr. President.
Okay. So do we have any questions on this? Because this group is going to go back to work. We're going to leave. John,
Question either for you, Mr. President, or Secretary Esper. What has changed that is allowing these assets to be deployed now, whereas General Barr said in the past they were not available?
well, for a long time, we've had a lot of drugs coming into our country, and it's not that it's increased. We've probably got it down a little bit, but it's still a tremendous number. Families are being ruined, lives are. So as we deploy our service members to combat both threats abroad, invisible enemy at home, earlier today I spoke to our nation's incredible warriors and military families. Spent a long time on the phone with thousands and thousands of families that were hooked in. In order to stop the spread of the virus, some of these families have delayed planned moves to their next duty station. And in other cases, military families are also waiting longer to welcome home their heroes from deployment. There's a tremendous burden to bear, and the families have been involved with us for so long, and they are incredible. Without the families, they couldn't be the great service members that they turned out to be, and they understand that. And I must say, protecting our military families is our top priority. So they understand what's happening with respect to the virus, and they understand it well. They've been fantastic. As Commander-in-Chief, I'm deeply grateful for our service members, their spouses, and their children, whose love, devotion, and sacrifice keeps America strong. To make, procure, and deliver crucial medical supplies to our doctors, nurses, and healthcare workers, my administration is leveraging the might of American manufacturing, supply chains, and innovators across the industry and across every industry. And I just told you about Walmart, and I could tell you about many more. Hanes is making protective gear and masks, and we're making tremendous amounts of product. There's never been anything like it. At the same time, I tell the governors, get it yourself if you can from your local companies and your local warehouses and factories. If you can do that, you should do that. Because of the actions that we've taken under the Defense Production Act, manufacturers and suppliers are sharing with FEMA and HHS their planned orders and allocations to states and to hospitals all over the region. This enables FEMA and HHS to work closely with states, local governments, and private sector to allocate critical resources to highly impacted areas. Working together, we're entirely focused on getting materials to the right place at the right time. So we wanted to go directly to a hospital or directly to a certain state location, and ideally not even hit the state's warehouses. If we can avoid the warehouses, it's even better because they go directly into a hospital. And one example of that is Ohio, the great state of Ohio. Senator Rob Portman called today, and he asked for some help and got us, did a tremendous job, along with Mike DeWine, the great governor of Ohio, to facilitate a donation of 2.2. Know whether or not they can use, especially our new test that was just developed by Abbott, which is almost instantaneous, which is going to be great. And remember this, we inherited, the word is we inherited bad tests. We really inherited bad tests. These are horrible tests. And it was broken. It was all broken. And we fixed it. And we're doing millions of tests. Sometimes we send out a test and it's not used. In many cases, it wasn't used. But we've worked with the states, and the testing has been pretty amazing, especially considering the fact that we inherited a very broken system. Jeff?
Mr. President, just to follow up on something you said before, are you considering a temporary ban on all domestic flights?
I am looking at hotspots. I am looking where flights are going into hotspots. Some of those flights I didn't like from the beginning, but closing up every single flight on every single airline, that's a very, very, very rough decision. But we are thinking about hotspots where you go from spot to spot, both hot. And we'll let you know fairly soon.
And what about rail travel?
A similar thing. We have trains going back and forth, and people don't think of trains, but we do a lot of transportation business. It's a very big decision to do that. And we're pretty late in the process from the standpoint that this is starting. You're going to start seeing, I think, over the next couple of weeks, you're going to start to see us hit a top and start coming down. So we'll make those decisions. Those are very, very big decisions from the standpoint of the future of our country, in a way, in the future of our country. We have to get our country back. We have to start moving again. We have to start working again. They're doing tests on airlines, very strong tests for getting on, getting off. They're doing tests on trains, getting on, getting off. But when you start closing up entire transportation systems and then opening them up, that's a very tough thing to do.
There continues to be a lot of public confusion about the use of masks. What is the
The
White
reuse. I love the sterilization of the masks. So, Ohio company, you can sterilize the N95. You can sterilize that mask for up to 20 times. Think of that, up to 20 times. We're throwing them out, and they're very expensive masks. They're throwing them out. And I kept saying, one of the first questions I asked to Dr. Fauci, I said, why aren't they sterilizing or cleaning the mask? Because I didn't, was it my thing exactly when we first heard about this? Nobody else knew it either. And now we have a company, and I guess a number of companies, one in Ohio, a great one, that makes equipment where you can sterilize a mask up to 20 times, which is fantastic.
What
Okay.
about you or me? What about the public? Should we be wearing masks out? We've heard lots of different recommendations.
I don't believe, look, there's a big thing, a lot of people don't like it. Some people don't like it because you're taking it away from the medical professionals. Some people don't like it for other reasons. I don't see where it hurts. And it doesn't have to be a mask. It can be a scarf. Scarf is highly recommended by the professionals. I don't see where it hurts. I think, frankly, if people wanted to do it, we don't want to do anything that's going to take masks. You're talking about a tremendous amount of masks when you do that. We don't want to take them away from our medical professionals, but I certainly don't see it hurting. But what I do see people doing now is using scarves. And I think in a certain way, depending on the fabric, I think in a certain way a scarf is better. It's actually better.
Mr. President.
Yeah, please, you didn't get, go ahead.
Thank you, Mr. President. I wanted to ask you about social distancing and how it applies to religious organizations.
Yeah.
Some churches, as you know, have continued to hold services, even though you have advised people that they need to practice social distancing. There was a pastor of a mega church in Florida over the weekend who held services that were attended by several hundred people. So my question to you is, should pastors be holding services in the middle of this pandemic? And even if they do, should Americans be going to
Well,
church?
my biggest disappointment is that churches can't meet in a time of need. You know, this is really a great time for churches to be together, for people to get together on a Sunday or whenever, any day, and meet. And yet, if you do that, if you do it close, you're really giving this invisible enemy a very big advantage. So it's the biggest, I think the single biggest disappointment is you can, one of the reasons I said, wouldn't it be great just to pick a date as, you know, I called it aspirational, an aspirational date would be Easter. And I will tell you, it's very, very disappointing. But again, you get too close, and if somebody's sick, you're going to probably catch it. So you have to be very careful.
Did they cancel
Yeah,
services?
just real quickly, Joe Biden's campaign came out with a statement today saying that
Sleepy.
Biden would be.
Did he
open.
write the statement, or did some PR person write
As
it?
far as I know, the campaign was wide awake, sir, and they sent out a
Good.
statement that
For a
Joe
change.
Biden would be open to having a phone call with you to talk about the coronavirus
That's
pandemic.
okay, sure.
Would you take his call? Would
Oh,
you?
absolutely. I'd
You
love
would talk to him
I'd
about
love to
it.
speak to him, sure. I mean,
How do you
he
think
should
you'd
be
work
able to.
together?
I always found him to be a nice guy. I don't know him very well, frankly, but I think he's probably a nice guy. No, if he'd like to call, I'd absolutely take his call. Okay? You could tell him, all right?
But you have talked about the failings of the Obama administration in leaving you with empty shelves and no plans.
Well,
They have
and
said
no
you got-
ammunition,
They have
and
said you
maybe
got
no
rid of the
ammunition.
pandemic office and the National Security Council.
We didn't do that. That turned out to be a false story. Now you're starting to go, what, are you working for CNN?
I'm pointing out what they have said and what you have
Thought
said.
you were
That's
with
all.
Fox. But Fox isn't so easy either. Don't kid
Mr.
yourself.
President, this is not
Hey, look,
about-
John,
this
let me
is
tell you
not about
something.
Fox or CNN.
You know
This
that's
is
a
just about
false
statement.
story. What you just said is a false story. This doctor knows it better than anybody. No, but you shouldn't be repeating a story that you know is false. All right, who's next? Please, go ahead, in the back, you didn't get it.
Talk about Iran, and Iran is struggling with the virus.
It's very
and
sad what's happening in
a
Iran.
broken economy. Under which conditions would you consider suspending, saying, U.S. sanctions?
Well, look, we have to talk to them. I think we could work out a deal with Iran very quickly. All they have to do is call. I just think that, you know, they're proud people, and the leadership is proud. They're proud, like all of us. We're proud. You people are proud. They're having a hard time picking up the phone, or they're having a hard time setting up the meeting. But they could fix their country pretty easily. And we don't want hostility. But if they are hostile to us, they're going to regret it like they've never regretted anything before, as per today's statement. But all they have to do is call or have somebody call. You know, there are channels where we can deal very easily. Again, I think that John Kerry did a tremendous disservice. I think he violated the Logan Act 100%. That's what I think. And I think it made it tough for them because they were dealing with him for years. It was a terrible deal. All of that money, $150 billion plus cash, plane loads of cash for a deal that was no good and was short term. Essentially, it was a short term deal. Who makes a deal for that kind of money and $1.8 billion in cash? I don't even know what that would look like. That would be, this room would have to be filled up 5 times with $100 bills, okay? Who makes a deal like this? And then on top of it, the deal's no good. All right, how about 1 or 2 more?
On our end, Mr. President.
Mr. President, Seattle police have reported a surge in calls about domestic violence. A number of groups have raised
About
concerns.
Mexican violence?
Domestic violence. A number of groups have raised concerns that the longer people are stuck at home, the more domestic violence cases there are going to be. Do you share those concerns, and what is being done
Well, it
to make
could
sure?
be. It's another cost of not getting our country working. I mean, people are, now some people are getting along great. I've also had the exact opposite question. Families are coming together. They're actually coming together. They haven't talked for a long time, and now all of a sudden they're talking again. They're loving each other. So I've heard that too. But I also have heard domestic violence, much, at a higher level. And drug use because of, in this case, they'd lose their jobs. They had a great job. They had a great life. They have a great family. All of a sudden, a husband's told that he doesn't have a job anymore and he's got no money. And that brings drugs into it. That brings suicide into it. It's a terrible thing. We have to get our country going again. We did the right thing. We had no choice. We did the right thing. Other countries tried to use the herd or the herd mentality. It's just, something that doesn't work. If you look at, just to say, I heard Sweden gave it a shot, and they saw things that were really frightening, and they went immediately to shutting down the country. We did the right thing, and we did it early. And we stopped other people from coming into our country early. But no, that's a cost. I've been talking about that. People say, "What are you talking about?" But you'll have that. You'll have domestic violence. You'll have violence. You'll have suicide. You'll have drug addiction. A lot of people are going to be lost. We want to get this open as soon as we can. I'll be the happiest person. So will you, everyone in this room. Happy when we get the word that this is the time, and we have our common sense, and they'll give me a decision, or they'll be making certain statements, and I think I'll know how to interpret those statements very well. I'll be with Mike. I'll be with the task force. I'll be with a lot of very talented people, including the two people on stage with us. But I look forward. That'll be a great day. All right. How about one more, please?
Can I ask a question of Mr. Wolf? Can I ask a question for
Sure.
Secretary Wolf?
Check.
What is the current contingency plan in ICE detention centers where cases of COVID-19 are already popping up? Some people have been released. Is there a contingency plan, and would you release the most vulnerable people like children and the elder?
Well, ICE looks at, on a case-by-case basis, even well before COVID, on looking at certain detention facilities and determining on a case-by-case basis if they do need to release individuals. And when we do that, we often put them on alternatives to detention as well. In the case of COVID, we're looking at vulnerable populations, and again, ICE is doing that in conjunction with CDC and other medical professionals. And in some cases, we do need to do that for the health and safety and the well-being of those detainees. But again, that's a case-by-case basis. We're not going to make any blanket statement that we're going to release individuals of whole groups at a time. So it's really important, and I've said it twice now, it's really a case-by-case basis, determining the health of that particular population or detainee, the facility they're in. Different facilities have different capabilities, whether it's an ICE-owned facility or it's a contractor-owned facility. And so we're certainly doing that. We're doing that today. We've been doing that for the past several weeks.
Did you say how many have been released?
While you're up, could you talk about how tight that southern border is right now?
Absolutely. We continue to build miles of the wall every day. We're up to over 150, I believe. We're continuing to build new miles of wall. And a lot of folks ask about replacement wall or new miles. And it's a new capability on our southwest border that we haven't had before. And so whether you talk to the agents, the Border Patrol agents, they like that capability, they like that impedance and denial that it provides them. And it provides the ability for those agents to focus elsewhere on parts of the border that are very difficult to patrol, so we can use our resources in a different way. And so we see a lot of benefits from the border wall system. And again, that includes not only the physical infrastructure, but the cameras, the roads, the lightings, the fiber optic cables. And we're looking forward, and we're still well on our track, well on our mark to meet 450 miles by the end of the calendar year.
And what actions are you taking
Mr.
inside?
Wolf, can I get one more question from you while you're here? There's been concern among farmers about being able to get enough migrant labor to keep the food supply moving as we go into the harvest season. What are you doing to address that?
Well, at the direction of the Vice President and the task force, we are looking at a number of different options with the H-2A workers that you mentioned on how do we either extend the validity of their visa, or looking at a couple of different options. Nothing to announce here today, but again, at the direction of the President and the Vice President, we're looking at a variety of different options that I think we will have soon, and it'll be very beneficial.
What about waiving
But I
visa
am glad
restrictions
you
for-
asked that question, because we want the farmers, they've had this for years. We want the farmers to be able to get the people that have been working those farms for years, or we're not going to have farms. So they're going to come in, and they're going to be given a certain pass, and we're going to check them very, very closely, especially over the next month. Because remember, after a month or so, I think once this passes, we're not going to have to be, hopefully, worried too much about the virus. But we want them to come in. We're not closing the border so that we can't get any of those people to come in. They've been there for years and years, and I've given the commitment to the farmers they're going to continue to come, or we're not going to have any farmers. Okay? Yeah, one more question. Who are you with, by the way?
I'm with Voice of America, so
Why?
what about waiving visa restrictions
Amazing.
on immigrant
Okay,
doctors?
who else, please?
at the risk of getting chewed out again.
No, you won't.
Mr. President, the IRS is requiring people who don't normally file income tax to file a simple income tax return in order to get their $1,200 check. Is that the way it's going to be, or is there something you can do to?
I had heard that. Now I don't know. Do you know that answer, Mike?
IRS issued some guidance.
Yeah.
It sounds like it. I
It's
mean,
not in the
we'll
bill, but
get,
it's
we
higher
can get
than
back. Yeah, it's a process that they're working on. We'll get back to you as soon as we find out. All right, one more, please.
Mr. President, you spoke with President Bolsonaro of Brazil today.
I did.
and
I spoke to him,
According
yes.
to his Twitter.
He's great. He's a great guy, and he's doing a wonderful job.
Still
From
meeting
Brazil.
with his
Spoke to him
supporters,
this morning.
talking to them. So what
And
is your
just a
assessment?
very complimentary call. He's working very hard. He's got a problem with the virus, got a big problem, and we talked about it today at length. We had a call this morning, and Brazil is shut down, as you know. They weren't going to shut it down, but they had to. So Brazil is shut down. The world is shut down. Nobody's ever seen anything like this. The entire world is shut down. You go from having the most powerful economy in the world and from other countries that are doing well to being everything is shut down. It's very sad, but we're going to get it going, and we're going to be stronger than ever. I really believe that. We're going to be stronger. We're going to have a big bounce, a very big bounce when this is gone. And I just want to thank the American people. I want to thank these great professionals, and I want to thank the media, because really, for the most part, the media has been very fair. Thank you very much, everybody.
Thank you, Mr. President.
Thank you, Mr. President.